As a heart surgeon with many years of experience, I've met countless older adults who come to my office concerned about chest pain, shortness of breath, or sudden tiredness. Often the problem isn't just poor diet or stress. It's a medication they've been taking for years, sometimes prescribed for a different health issue. Many seniors don't realize that some common pills, used daily by millions over 60, can quietly harm the heart, raise blood pressure, or cause irregular heartbeats. These medications may not show problems right away, but over time, they can weaken your heart and affect your health. In today's video, I'll share the 10 most risky pills that could be hurting your heart without you knowing. This isn't meant to scare you, it's about helping you stay informed. If you or someone you love is over 60 and taking medications for pain, sleep, blood sugar, or mood, you need to watch this till the very end. Pill number 1 is the most harmful and the most commonly used. I am not asking you to stop anything without medical guidance, but you deserve to know the truth. So let's begin with pill number 10. Margaret had been living with arthritis for over a decade. Her joints ache every morning, and some days getting out of bed felt like climbing a mountain. So when her doctor prescribed corticosteroids, little white pills that promised relief, she felt hopeful again. And for a while, they worked. The pain faded. She could walk her dog again, even enjoy gardening on sunny afternoons. But then something changed. She started waking up with swollen feet. Her blood pressure, once normal, began creeping higher. Her heart felt like it was racing after the simplest chores. At first, she blamed it on age. "I'm just slowing down," she told herself. But the truth was harder to face. The very medication that was helping her joints was quietly hurting her heart. Corticosteroids, like prednisone, reduce inflammation, yes, but they also cause the body to retain sodium and water. That extra fluid builds up in your blood vessels, increasing pressure, forcing your heart to work overtime. For seniors whose arteries may already be stiff or narrowed, this silent strain can be devastating. Over time, corticosteroids can raise blood pressure, trigger arrhythmias, and even weaken the heart muscle itself. And the worst part? These effects don't happen overnight. They creep in, softly, slowly, until one day, you're out of breath after climbing a single flight of stairs. Margaret eventually saw a cardiologist who connected the dots. They adjusted her dose, added supportive meds, and explored natural anti-inflammatory alternatives. Today, she still manages her arthritis, but she also protects her heart, because pain relief should never come at the cost of heart damage. If you or a loved one over 60 is on corticosteroids, don't panic. But don't stay silent either. Ask your doctor for regular blood pressure checks, heart monitoring, and low-sodium diet support. And remember, the heart doesn't always scream when it's suffering. Sometimes it just whispers through fatigue, swelling, or a quiet racing beat. Listen to it. Your relief should feel complete, not like a silent trade-off. Pill 9. Non-steroidal anti-inflammatory drugs, often called NSAIDs, include medications like ibuprofen and naproxen. These are used for arthritis, joint pain, or back pain, common issues among seniors. Many people over 60 use them daily without realizing how dangerous they can be to the heart. NSAIDs can raise your blood pressure and cause fluid retention, which puts extra strain on your heart. For someone with a weakened or aging heart, this additional pressure may be enough to trigger heart failure or irregular heartbeat. Over time, NSAIDs can damage blood vessels and reduce kidney function, further burdening your cardiovascular system. If you already have high blood pressure or take medications for your heart, these pills can quietly interfere with your treatment. You may not feel the effects right away, but your heart is under constant pressure. That's why I always tell my senior patients to be very careful with over-the-counter painkillers. There are safer options for pain relief that do not increase heart risk. Always talk to your doctor before continuing NSAIDs for more than a few days. Pain relief should not come at the cost of your heart health. Let's move to pill number 8, which is even more dangerous over time. When Robert was diagnosed with prostate cancer at 72, he didn't hesitate. "Let's fight this," he told his doctor. His children rallied around him, and he began chemotherapy with hope, courage, and the quiet determination of a man who'd lived through harder days. The chemo was tough. Fatigue set in. His appetite faded. but no one warned him about the pressure in his chest or the way his heart began to flutter at night. Maybe it's just the stress, he told himself. But the truth was more complicated. What Robert didn't know, and what too many seniors aren't told, is that some chemotherapy drugs can quietly damage the heart. Medications like doxorubicin, commonly used to treat cancers in older adults, are powerful weapons. They target fast-growing cancer cells, but they can also affect the heart muscle itself. Over time, these drugs can weaken the heart's ability to pump, leading to shortness of breath, swelling, and even heart failure. The medical term is cardiotoxicity, but Robert just knew something felt wrong. He wasn't alone. Studies show that seniors, especially those with prior heart issues, are at higher risk, and the damage often doesn't show up right away. It can appear months or even years after treatment ends. Many survivors blame age or just being tired, never realizing their heart is quietly struggling from the fight they already won. But here's the good news. With early monitoring, regular heart checkups, and adjustments to treatment plans, this damage can often be reduced or avoided. Robert's oncologist worked with a cardiologist, a growing specialty now called cardio-oncology, to adjust his medication and protect his heart while still fighting the cancer. Now, 2 years later, Robert is cancer-free. He walks daily, plays chess with his grandson, and yes, he still gets regular heart screenings. Chemotherapy is a brave battle, but every warrior deserves protection. If you or a loved one is over 60 and undergoing chemo, don't just ask how it will fight cancer, ask how it will protect the heart. Because surviving should mean living fully, not just getting through. Your heart fought for you. Make sure you fight for it too. Feel 7. Certain diabetes medications. Thiazolidinones. If you are managing type 2 diabetes, there's a class of medications called thiazolidinones, including drugs like pioglitazone. These are designed to lower blood sugar, but they may quietly harm your heart. These pills can cause fluid buildup, swelling in the legs, and even lead to congestive heart failure, especially in seniors over 60. While the intention is to manage blood sugar, the hidden risk to your cardiovascular system is serious. Many seniors with diabetes are already at high risk of heart disease. When you add a drug that puts more pressure on the heart by causing the body to hold extra fluid, it becomes a dangerous mix. Even more troubling, these pills can mask early symptoms of heart failure, like tiredness or shortness of breath. Some doctors may still prescribe them because they work for blood sugar control. But if you have a history of heart disease or even mild swelling, this medication can silently accelerate damage. Always ask your doctor if a safer alternative is available. Your blood sugar matters, but not at the cost of weakening your heart. Linda, 67, just wanted more energy. She used to love morning walks, gardening, and keeping up with her grandkids. But lately everything felt heavier, mentally and physically. A friend mentioned a pill that helped her stay alert and lose a little weight. It's prescribed for focus, she said, totally safe. So Linda talked to her doctor and began a stimulant medication, commonly used for ADHD or weight loss. At first, it felt amazing. Her mind was clearer, her steps lighter, but then the side effects crept in. Her heart raced after breakfast, she started waking up anxious, and one afternoon after climbing the stairs, her chest tightened in a way she'd never felt before. That's when her cardiologist explained what most seniors don't know. Stimulants can be dangerous for the aging heart. These medications, often containing amphetamines, work by increasing dopamine and norepinephrine, which sharpens focus and suppresses appetite. But they also raise heart rate and blood pressure, putting your cardiovascular system into a constant high alert state. For younger people, the body may handle that stress, but after 60, the heart's resilience changes. Arteries stiffen, rhythms become more fragile, and stimulants can tip the balance. Linda's story isn't rare. Many older adults are prescribed these medications for energy, attention, or even to treat misdiagnosed depression. And while they may offer short-term benefits, the long-term impact on the heart can be devastating. Increased risk of atrial fibrillation, hypertension, and even stroke, especially in those who already have silent heart issues. The worst part? Many seniors don't feel the warning signs until it's too late. They mistake the heart flutter for anxiety, the breathlessness for aging, sleeplessness for stress. But the body always speaks. And for Linda, it spoke just in time. She worked with her doctor to taper off the stimulant safely. She shifted her focus to heart-supportive habits, movement, hydration, nutrition, and found new energy without the artificial push. Her chest pain stopped. Her heartbeat steadied. Not all pills that promise energy are your friend. If you or someone you love is over 60 and considering or already taking stimulants, ask the deeper question. What is this doing to my heart? Because clarity, energy, and focus should never come at the cost of your most loyal organ. Protect your heart. It's already doing so much to protect you. Pill 5. Sleeping pills. Sedative hypnotics. Many seniors struggle with sleep and rely on sedative hypnotic medications like zolpidem or older drugs like diazepam. These pills promise better sleep, but they often come with serious consequences for your heart. Sedatives slow down your entire nervous system, including your heart rate and blood pressure. While this may sound helpful, it actually lowers your body's ability to respond to stress or oxygen demands during sleep. Over time, these drugs can cause sleep apnea or worsen existing apnea, a condition where you stop breathing for short periods during the night. This puts extreme pressure on the heart and can lead to dangerous heart rhythm disturbances. Also, these medications can interfere with essential heart medications such as beta blockers, making your treatment less effective. The risk of falls, confusion, and breathing problems further increases with age, especially for those taking other medications. Poor sleep must be addressed, but long-term dependence on sedatives can slowly harm your brain and heart. There are natural and safer ways to improve your sleep without this damage. Talk to your healthcare provider before continuing any sleeping pill regularly. We'll now move to pill number 4, which is a common mood stabilizer that might be slowly hurting your heart without your knowledge. Pill 4. Tricyclic antidepressants. Tricyclic antidepressants are older medications prescribed for depression, anxiety, or chronic pain. Drugs like amitriptyline or nortriptyline were once commonly used, but they come with heart risks, especially for people over 60. These medications can cause a variety of cardiac issues, such as irregular heartbeat, blood pressure changes, and even a dangerous condition called heart block. Over time, they can interfere with the electrical signals that control your heartbeat. This makes them particularly dangerous for seniors who already have arrhythmias or a slow heart rate. These drugs also increase the risk of dizziness and falls, which can lead to injury and further complications. Even if the dose is small, taking them for long periods without monitoring can be harmful. There are newer antidepressants that are much safer for the heart and brain in older adults. Unfortunately, some doctors still prescribe these older medications out of habit or cost concerns. If you are taking a tricyclic antidepressant and feel tired, dizzy, or have heart flutters, do not ignore it. Always ask your doctor if there's a safer alternative. Up next is pill number 3, and it's something that millions of seniors are taking daily for a very common issue, but with hidden risks. Pill 3, decongestants, pseudoephedrine, and phenylephrine. Decongestants like pseudoephedrine and phenylephrine are found in many cold and allergy medications. Seniors often use them to relieve nasal congestion or sinus pressure, especially during seasonal changes. But these pills can be very dangerous for your heart. They work by narrowing blood vessels to reduce swelling in the nasal passages. However, they also narrow blood vessels throughout your body, including those that supply your heart. This raises your blood pressure and forces your heart to work harder. For seniors, this extra strain can be dangerous, especially if you already have high blood pressure or heart disease. These pills can also trigger irregular heartbeats or palpitations. You may feel jittery, anxious, or even dizzy after taking them. That's your heart telling you something is wrong. Many people assume these medications are safe because they're sold over the counter. But age changes how your body reacts, and what once felt harmless in your 40s can now be a major heart risk. Always read labels carefully and talk to your doctor before using any decongestant. Let's move on to pill number 2, one that seniors often take for long-term acid reflux without knowing its silent effects on the heart. Pill 2, proton pump inhibitors, PPIs. Proton pump inhibitors, commonly known as PPIs, are medications like omeprazole or pantoprazole used to treat acid reflux and heartburn. Millions of seniors rely on these pills daily, believing they are completely safe, but recent studies have shown that long-term use can increase your risk of heart problems. PPIs reduce stomach acid, which is helpful for reflux, but that same acid is also essential for absorbing key nutrients like magnesium. Low magnesium levels can lead to irregular heartbeats, fatigue, and even muscle weakness. Over time, PPIs can also disrupt your gut bacteria and contribute to inflammation, which is directly linked to heart disease. If you are taking PPIs for more than a few weeks, and especially if you are over 60, it's time to reassess. These medications should only be used for short-term relief unless absolutely necessary. If you're experiencing persistent heartburn, work with your doctor to find the root cause rather than masking it. Long-term heart health must always come first. Now it's time to reveal pill number 1, the most dangerous and commonly used pill that is quietly weakening senior hearts across the world. Pill 1, calcium channel blockers. Calcium channel blockers are medications often prescribed for high blood pressure, chest pain, or arrhythmias, but certain types, especially older ones like verapamil and diltiazem, can be dangerous for seniors. While these pills are effective at relaxing blood vessels, they can also slow down the heart too much. For seniors whose heart function may already be reduced, this can lead to dangerously low heart rates, dizziness, and even fainting. Over time, they may cause swelling in the legs, shortness of breath, and heart rhythm changes. Some calcium channel blockers can also interfere with other medications seniors often take, increasing the risk of complications. The biggest issue is that many seniors are prescribed these without regular monitoring, and side effects may be blamed on age rather than the drug itself. If you are experiencing fatigue, swelling, or a slow pulse while on these medications, it could be a warning. Never stop heart medication without your doctor's supervision, but always ask if there's a newer, safer option for your condition. This pill is powerful, but it needs close oversight. Now let's wrap up everything we've learned today with a final thought. If you're over 60 and taking any of the pills we discussed today, I am not telling you to stop them on your own, but I am urging you to talk to your doctor. These pills were designed to help, but when taken long-term or without proper monitoring, they can slowly damage your heart. As a heart surgeon, I've seen too many seniors hospitalized not because of illness, but because of the side effects of their medications. The goal is not fear, it's prevention. With the right awareness and support, you can protect your heart, live longer, and feel better. Stay informed, stay alert, and never be afraid to ask questions about the pills you're taking. Your heart is too important to ignore. If you found this video helpful, please share it with your loved ones and subscribe for life-saving advice tailored for seniors like you. Take care and stay strong.